Hi, good morning, everyone. I'm Mia Collett from Panoramic Associates. I'm the business manager of the Health and Social Care Division. And today I'm joined by Greg Fell. Greg, can you please start by introducing yourself?
Hi, I'm Greg Fell. By day, I'm the Director of Public Health in Sheffield, and in my spare time, I'm the President of the UK Association of Directors of Public Health.
Fine. Thank you, Greg. Can you please provide a brief overview of your career journey?
Okay. Like most directors of public health, it's odd and mostly unique. But for me, I got to the end of a 3-year degree in biochemistry and physiology and decided I didn't want to work in a lab, nor did I want to be a science teacher, nor did I want to work for the pharmaceutical industry. I thought, oh, right, what am I going to do now? So ended up at what was then Hull University Nursing School doing some research around smoking and drinking in pregnancy. And from there got into what was then called health promotion. It's now called health improvement, and basically progressed through a career. Eventually did the public health training scheme, which is what prospective public health consultants do before they become public health consultants. Did that, spent 7 years in Bradford doing a very healthcare oriented public health role, and then eventually was persuaded to apply for this job in Sheffield, thinking I'd never get the job. But they were foolish enough to appoint me, and I've been here ever since and loved every day.
Brilliant. Thank you very much. And what is the role of a Director of Public Health to you?
So that's the question we all hate answering in the pub. Contrary to popular opinion, we do go to pubs. But broadly, 6 areas. Firstly, there's the responsibilities of the grant. So that's a bag of cash that pays for sexual health services, drug and alcohol treatment services, health visiting, school nursing, a whole range of other stuff. And other is where all the interesting things are. That's responsibility 1. Responsibility 2 is around health protection, outbreaks of infectious disease. You'll remember we were busy with one of those a few years ago. There will be another pandemic. I hate to break it to you, but there's going to be another one. Who knows when? But other outbreaks of infectious disease happen all the time. And our job in that is to coordinate the how do we know what's going on here bit of that, and then the what are we going to do bit of that. And sometimes that involves for food-based outbreaks, it involves environmental health. For vaccine preventable disease-based outbreaks, it involves sticking needles in arms. And very occasionally, chemical radiological incidents. So you'll all remember when Putin poisoned the Skripals in Salisbury. It was Tracy Myopo who was on point. And the BBC docudrama documents that really, really well. So that's going to happen on somebody's watch somewhere. You'll hope it doesn't happen on your watch, but it will happen on somebody's watch. That's chunk 2. Chunk 3 is health improvement. So basically everything that runs from tobacco, obesity, weight management, gambling harm, right the way through to what folk call the determinants of health, but other folk call air quality or poor quality housing or lack of access to green space, all of which matter to how healthy we are. Some of those things are absolutely my parties to control and coordinate. Tobacco is a good example. Some I contribute to a bigger party. So poverty, arguably the most important determinant of health, I don't hold all of the levers. And so my job is to contribute to a bigger party on how we both alleviate and prevent poverty. So the next area is health intelligence. Someone will ask, how healthy is Sheffield? How do you know that? And some poor soul's got to crunch the numbers. So a team of people that does the number crunching, basically applied epidemiology and applied demography. And the last area is pulling it all together into a coherent whole. So what is the strategy for health for the city of Sheffield? And we have one, it's called the Health and Wellbeing Strategy, and its strength and its weakness is that it's a strategy. It's 15 pages long, and it doesn't document what we're going to do around air quality in 14 years' time. It documents that its goal is to reduce the gap in healthy life expectancy between the haves and the haven't. And all of that together is my job, and that's why we hate answering the question in the pub. What do you actually do then? Because it's kind of hard to do the elevator pitch on that.
So what is unique about the population in Sheffield that brings both opportunity and challenge?
So I thought about this, and this was the hardest of the questions. All of our cities, all of our places are sort of unique. What makes Sheffield more or less unique than anywhere else? I don't know, actually. But a few thoughts. It's about 1% of the population of England, so that makes maths really easy. You either take 2 noughts off or you add 2 noughts on to any stat, and you can kind of do the two-way thing. And it's about average health-wise. It's a city of divides. So it's kind of like all places that there's a socio-economic dividing line. And for Sheffield, that's broadly the east versus the west of the city. And there's the big gap in healthy life expectancy between the east and the west of the city. It's very, very, very extremes. It's somewhere in the order of 20 years. It's not okay. But all cities and places can tell something along those lines. It's the healthiest of the core cities, which is clearly good. And plenty of success stories. We all have examples of things that we can name as success stories. One of mine is tobacco, actually. Tobacco is still the new tobacco, and we're doing quite well on tobacco. We've got prevalence down to about 12% there or thereabouts. That hasn't happened by magic. It's happened because we worked really hard on it over a long period of time. Some things aren't going so well. Clean air is one example. We have some peculiar and particular challenges around housing and poor quality housing in Sheffield. So all of those collectively add up to poorer health than we might otherwise have had. So whether or not we are unique is debatable, but those are sort of a picture of the health of Sheffield. It's a very green space. We're blessed with green space. Obviously, the Peak District on the doorstep is an amazing asset, and we exploit that for all of its worth. But just even within the city, I think there's something akin to 900 parks and green spaces within the city. And we make great use of those, and those do matter to the health of the population. What makes us unique, however, is tricky, and I'm not quite sure I know the answer to that one.
I think you have in pockets. Thank you very much. So as the ADPH president, you're involved in representing the Directors of Public Health on a national level. How does that support your local practice?
So there's a two-way thing here. Firstly, the being a jobbing DPH gives me a certain amount of credibility because I know how these jobs roll, and I know the joy it can bring, and also the frustration and challenges it can bring, and whether or not that DPH is in England, Wales, Scotland, Northern Ireland, or the territories, the job is broadly the same with a few minor differences. So I know how the jobs roll. So being president of ADPH, I have a sense of how the day job runs and the challenges that will exist in any given part of the world, in a broad macro sense, maybe not the micro and minutiae. So that cuts one way, but then the other way to sort of being president, how I kind of maximize that locally. Sort of networks, insight, influence. I get access to a whole bunch of information and intelligence that you just wouldn't otherwise get. And I play that locally in my day job too. But also, again, coming back to the other way, that does cut both ways. So I use the sort of, clearly I know most about my experiences in Sheffield. I don't know the day-to-day joys and curses that say the DPH in Northeast Lincolnshire has. But I will use my day-to-day experiences when I'm having conversations with various bits of government and or other national stakeholders. So kind of it's a two-way street, but it does matter that you've got credibility as a DPH in your local day job too. Yeah,
I can imagine. Thank you. And the next question, casting your mind back, what is the most rewarding experience you've had as a Director of Public Health so far?
So this and the next question, broadly the same, and it's the sort of the predictable answer, the pandemic. So I'm on my second thing that's been a pandemic. Swine flu was the first, and this one was the second, but arguably HIV was a bit of a pandemic. So pandemics come and go, but the one that we've just lived through, the COVID pandemic, was the big one, the one that we all feared. And if that wasn't the big one, the next one may be worse, who knows? But I wouldn't want to see the big one. It was exceptionally challenging. It was also exceptionally rewarding in equal measure. We can all remember just the sheer grind of week after week after week after week of 14, 15-hour days on back-to-back Teams calls and Zoom calls. And it was quite tough, but also it's quite challenging, quite rewarding. You're kind of at the centre of the worst global emergency since World War II, certainly the worst public health emergency ever. And probably the worst emergency that the world has faced since World War II. It was quite rewarding, although it was tough in equal measure.
Okay, brilliant. Thank you. And what's one thing you wish you would have known, or a skill that you wish you would have developed before becoming a Director of Public Health?
Juggling. Just the sort of the range, the answer to the earlier question gave the sort of the sense of breadth of scope. from one meeting about poverty to another meeting about economic policy and strategy to a third about cold, damp, mouldy housing to a fourth one about tobacco. The ability to juggle all of that stuff. So juggling is quite an important skill. And you never quite get into the detail of all the minutiae. You have to trust that you've got an amazing team. This is a team sport. So you trust you've got an amazing team who hopefully have a pretty good grasp of the detail. But even then, sometimes things will go wrong along the way, and you sort of have you got a team of people that can organise the response to problems when they crop up. Being able to juggle all of that is something that most of us haven't quite got the breadth of when you first walk into the job. Arguably, there's no shortcut to that. The other one is budgets. Most folk I know haven't got a significant budget management experience when they walk into a DPH job, but then you landed for me with a budget of £36 million. Manage this safely, please. So there is something about getting exposure to that world before you jump into a DPH job. That invariably helps you with job interviews, no doubt about that. But it also helps you with the day-to-day practice as well.
Okay. Thank you. And what comments do you have on the future priorities of public health?
There's something about there's a national and a local answer to this. There's something about a fragmented public health system. So public health is what not an individual actor sport. It's a team sport, and there's a whole bunch of stakeholders in that team, some of which have got the word public and health in the job title, some of which don't. The vast majority of jobs in public health don't have the words public and health in the job title. So kind of pulling all of that together into a coherent system does matter. Resourcing, our budgets are 25% smaller than they once were. That means less sexual health services. It means less health visitors. It means less drug and alcohol treatment services, though that's been put right to an extent. But the budgets are smaller. We get what we pay for. We all want public health, and we all want more public health until it comes to the point of paying for it, and then everybody stares at the floor. So that's one set of things. And the second set of things is around cross-government. That if you're not talking child poverty, poor quality housing, air quality, lack of access to healthcare matters as well. But you've got to talk about all of those things and how they impact on health. The exercise of public health across the totality of government is a big priority for any future government. It's arguably the reason why local government exists. It was set up on account of the 1875 Public Health Act. So and it kind of does work at local government level, not perfectly all the time, but more often than not it does work. And then two specific things. Poverty is the preeminent determinant of the health of any given population. You look at any health metric, it divides along the income and poverty line. And then secondly, the one that we're not talking about half enough that we should is climate. The health impact of climate change in many, many different ways will dwarf COVID by many, many orders of magnitude. So we need to be prepared for that and do our bits to mitigate it as well. Yeah,
I agree. Thank you. And the next question is on the topic of interviews. How should aspiring directors of public health prepare for their interviews?
Get to know the place really well. Read as much as you can about the place. DPH job interviews are usually member appointment panels. Members care deeply about their place. They're elected by people from a place. They will know way more about the place than any aspiring interviewee will. Get to know as much as you can about the place and the politics of the place. It's a member appointment panel, usually, not always. So you've got to get to know the local political dynamic, the local nuances as best you possibly can. No shortcut for doing homework on that. Get to know the key councillors, get to know the corporate plan and couch your answers in an interview scenario against the council corporate plan or the health and wellbeing strategy or something similar. And for any aspiring DPH interviewee, the question is, what do you add to the party? There's an already well-established party, and what do you add to it? What unique skills, talents, and experiences do you bring to add to the party that's been going for about 150 or so years?
Yeah. Okay. Great advice. Thank you. And the last question is, what is one final piece of advice that you've got for aspiring directors of public health?
So we run scared of the political question. Health is political. There's no way of avoiding that. And by health, I mean health. I don't mean healthcare. Healthcare is also political. But health is political. There's no way of avoiding that. Our job is to make it not party political. And treading that line between political versus party political is delicate and needs an awful lot of care. And there's something about science versus politics. The credibility comes from the ability to manage individual programs and then groups of programs together, but applying scientific wisdom, aka the mini chief medical officer role, to that in a political context, and often a party political context. The ability to tread that line. You can't come pre-armed with that. It comes through experience, and you can't learn that from a book. It can only come from experience. So that I'd encourage any aspiring DPH to be thinking carefully about that space.
Okay, brilliant. Thank you. Thank you, Greg. That's been incredibly insightful. That concludes today's podcast. So thank you again, Greg.